Hola y bienvenidos to today's webinar, Understanding Afro-Latina Experiences Through Data Disaggregation. My name is Cecilia Nunez. I'm a mixed Black Latina woman from the Los Angeles area, a third-year dual degree Master's of Public Policy and Social Welfare student here at UCLA, and a research fellow at the UCLA Latino Policy and Politics Institute, or LPPI. The Institute addresses the most critical domestic policy challenges facing Latinos and other communities of color through research, advocacy, mobilization, and leadership development led by us for us. On behalf of LPPI, I want to say how excited we all are about this incredible conversation we're about to have and the work that the Institute has done with its partners to ensure that Afro-Latina policy and mobilization is a major part of its mission. This webinar is in many ways a culmination of conversations that we have been having here at LPPI about a need to ensure that spaces for Latino thought are also thinking about anti-blackness as it exists in our community. Throughout American and Latin American history, the voices of Afro-Latinas have largely been made invisible in favor of a monolithic narrative that there is only one way to look Latino. Black Latino scholars and activists have challenged this notion, demonstrating the unique experiences of racism and oppression Black and Brown Latinos face both in larger society and by our peers. Today, we will focus on data disaggregation as one tool researchers can use to learn more about the ways in which the intersections of the skin color and Latinidad contribute to more complex discrimination. Our moderator and panel have all spent their careers researching, advocating, and building spaces for Afro-Latinas, and much of their work would not be possible without data disaggregation of Latinos by race and research. Some of us might be familiar with the Office of Management and Budget's March 2024 announcement of the adoption of a single question format to ask about race and ethnicity in future federal data collection instruments, such as the census. This decision will remove the Hispanic Latino ethnicity question and allow survey takers to identify their race as Latino alone. While some Latino advocacy groups have championed this decision as a step towards creating less confusion for Latinos in census taking, many Afro-Latina groups have argued that this move will lead to inaccuracies in counts for Latino and Black communities, and further conflation of our shared Latino identity and distinct races. During this webinar, we hope to explore the importance of this topic at this critical chapter in history for civil rights and social justice. We'll start today with moderator and panelist self-introductions, have a moderated discussion, and then open it up to our audience for Q&A. And with that, I'd like to pass it to our moderator, Dr. Nancy López, to introduce herself. Thank you.
Gracias, Cecilia. I'm so grateful to you and all of our colleagues at the UCLA Latino Policy and Politics Institute for your leadership and impactful work. Saludos, familia. Greetings, family. I'm professor of sociology at the University of New Mexico. I also co-founded the Institute for the Study of Race and Social Justice. I'm a Black Latina, US-born daughter of Dominican immigrants, sweatshop factory workers with a second-grade education who taught their 5 children everything that we know. Consejos like my Black Dominican mom would tell us when we face an injustice. No dejes que nadie robe tu derecho, ni tu felicidad. Don't let anyone rob you of your rights or your joy. I grew up in public housing. I attended de facto segregated high schools, and this informs my visceral commitment to intersectionality as inquiry and praxis for policy-relevant research. I hope that our conversation actually helps us think differently about how we could center the margins, what Professor Crenshaw has taught us, and also what Dr. Ruth Zambrana calls creates equity lifts, like Head Start, Upward Bound, all those programs I participated in and are part of the reason why I'm here today. Now I'd love to give the mic over to Michelle Bueno-Vazquez to introduce herself.
Thank you, Dr. Lopez, and thank you so much to the LPPI for putting this very timely and imperative panel together. My name is Michelle Bueno-Vazquez, and I am a PhD candidate at Northwestern University in political science, and I am a master's candidate in applied statistics as well. I study race and the construction of race and how to measure that in quantitative measures, as well as how to inform quantitative measures by the lived experiences of people. My focus in my research is the construction of race for Latinos in the United States and the transnational forces that have led to that certain construction, such as US occupations in Latin America, and in my and Dr. Lopez's country of ancestry, the Dominican Republic, that faced to US occupations that happen to have instilled certain racial hierarchies in our country that are not entirely endogenous to it. As such, I study the US Census, the development of race categories, and how these race categories impact communities today, particularly Afro-Latino communities, and contributing to Afro-Latino erasure. And you can see some of my work in the Washington Post. I've published with the Monkey Cage, a few articles on Afro-Latino erasure and Afro-Latino politicians. And otherwise, I am enjoying this panel already and looking forward to learning more from you all.
Mil gracias. And right now I'd love to have Dr. Adolfo Cuevas introduce himself.
Saludos, Adolfo Cuevas. Thank you so much, Dr. López. Great to be here with this wonderful panel. So I'll begin by saying that I am assistant professor in the Department of Social and Behavioral Sciences at NYU School of Global Public Health. I'm also deputy director of the Anti-Racism, Social Justice, and Public Health Center here at NYU. I'm also Afro-Dominican. I grew up in Washington Heights in New York City. And I would say that a lot of the work that I do really is encapsulated by the term research is me-search. I really try to identify and measure aspects of racism from structural to interpersonal forms and how those exposures really get under the skin to increase the risk of disease. And back in 2015, I needed to kind of quenched a thirst that I had within the space of public health by contributing more to the experiences of Afro-Latinos. And what I mean by this is actually highlighting, what it actually means to be Black and Latino/Hispanic. And I came out with a paper reviewing the large body of literature within the public health space on racial differences within the Hispanic population. And I was stunned by that review, whereby we only found about 22 articles that highlighted racial disparities within the Hispanic population. I was floored by it. We wrote a paper that came out in the American Journal of Public Health. And I think since then, there has been a growing movement to really try to both identify other forms of disparities, but then also identify and highlight the social determinants of these disparities as well. So it's a pleasure to be here, and I'm happy to engage in this discussion with everyone.
Gracias. Dr. Michelle Holder. I think you're muted. We're still not able to hear you. So unfortunately, we're not able to hear Dr. Holder. Maybe Dr. Jasmine Haywood can go next while we figure out what's happening.
Sure, no problem. I know how that feels. Good afternoon, good morning, everyone, depending on what time zone you are in. My name is Jasmine Haywood. I am currently a strategy director at Lumina Foundation, which is a private philanthropic organization that focuses on post-secondary learning for all students. So I do my work at the intersection of philanthropy and higher education. I started my career as an admissions counselor in upstate New York, and made my way over to the Midwest. Did both of my graduate degrees at Indiana University in higher education and student affairs. And most importantly, I am also Afro-Latina. Both of my parents are Puerto Rican, from El Bajío, New York. I grew up in upstate New York. And I've had, as I've lived in various places in the country, I've had a lot of different experiences. And like Dr. Cuevas said, when I was a faculty member at Indiana State University, my research focused on, it was also me-search, and it focused on the racialized experiences of Afro-Latino college students. My dissertation was titled Triple Consciousness. And so a lot of my research has stemmed from that work. I've been part of different media outlets like Univision, Vox, The Atlantic, etc. But one of my passions is really just getting the knowledge out there about how Afro-Latinos experience life and how they're racialized, and the extent to which, the factors that contribute to their experiences. So happy to be here, and hopefully Dr. Holder has figured out audio and we can hear her now. So I'll pass it over to her.
Dr. Holder, I did put my mobile in the chat for you if you wanted to try using that. So just in the interest of time, hopefully Dr. Holder will be able to introduce herself. Maybe as she answers one of the questions, I'm going to go ahead and pose the first question. On March 28th, 2024, the Office of Management and Budget, OMB, which among its responsibilities shapes the standards for data collection on race and ethnicity in all federal agencies, especially the census, announced that perhaps one of the most dramatic changes to the race and ethnicity section since 1977, the adoption of a single format for the collection of race and ethnicity data, making Hispanic Latino act as a race category. They call it co-equal, as opposed to a separate question of ethnicity. To review, race is a status based on the social meanings assigned with one's physical, visual characteristics, while ethnicity has to do with your status with origins, cultural background, nationality, or ancestry. Knowing this, what do you think are some of the implications of this decision, particularly for Afro-Latinos? And Dr. Holder, I'll just do a check and see if you wanted to introduce yourself via my phone, but I guess it's not working. So whoever would like to start.
I'll be happy to kick this one off. And if I may, I would love to be able to share this PowerPoint presentation that I prepared. Give me 1 second. All right. Can someone confirm that you can see this?
Yes, we can see it.
Wonderful. So I wanted to start answering your question by showing a little bit of the history behind where we're at today. So that famous 1977 Directive 15 that Dr. López mentioned in her question is the very first edition we see of any kind of mention of Hispanic in the 100% survey of the census. That means that every single person that gets the census, aka every person that is recorded in the country, would get this question asking if they were Hispanic. Before this, it was only like 5% of folks that would get this question on whether or not they were Spanish speaking. And I want to emphasize that this was a measure of whether or not these populations spoke Spanish, and not a measure of race or racial discrimination. So as you can see, the term Hispanic here is connected with Spanish speaking. And here are the results from that 1980 census showing that first change. In 1997, we get the birth of these big 5 categories that I think most folks here are probably used to seeing when they go to the doctor's office. Some of us saw it when we applied to college, when you're applying for a job. And basically these racial categories permeate every interaction that an American has, or anyone in the United States, regardless of their citizenship or nationality, any interaction you have with the state. So we're used to seeing these categories: Asian American or Pacific Islander, Native Hawaiian or the Pacific Islander. The term Hispanic changed to Hispanic or Latino. So here you have the categories American Indian or Alaskan Native, Asian, Black or African American, Native Hawaiian or the Pacific Islander, and white and Hispanic and Latino becomes a separate category, the first ethnic category we see. So in this 1997 enforcement, the purpose was to protect civil rights. So in the beginning, it was to record Spanish-speaking communities, but the OMB made very clear in 1997 that the purpose of this new Directive 15 was to ensure civil rights for people that might be discriminated against, AKA Latinos, which Latinos were facing high levels of discrimination, and Cuban, Mexican, and Puerto Rican activist groups in the 70s were the ones who actioned for the addition of the Spanish-speaking question to begin with. So let's do a quick fast forward to the 2020 census and what I call here brown washing. So in the 2020 census, the OMB actually added some examples for race and the ethnic category. So as you can see in the examples for the Latino category at the bottom left, we see yes, Hispanic or Latino or Spanish origin, Salvadoran, Dominican, Colombian, Guatemalan, Spaniard, Ecuadorian, etc. So as you can see here, Spaniard is given again as this example of Hispanic or Latino, when again, going back to the purpose of the 1997 directive of adding race and ethnic measures was to protect for civil rights of marginalized communities. So I ask you all to maybe question a little bit, what does a white European majority country of origin need federal civil rights protections that is actually meant for marginalized minorities? And I am of the expert opinion that the census inclusion of Spaniard as an example is not apolitical. So the Census Bureau added these examples to the race and census questions, aiming to include the top 5 Latino origin groups in the examples. And this is some text from the Census Bureau communication saying that it added Salvadoran, Dominican, Colombian, Guatemalan, Spaniard, Ecuadorian to represent the largest Hispanic origin groups. Yet by their own calculations, Spaniards are not even in the top 10. This is from the 5-year American Community Survey data on population, just raw population counts. So we see top 5 is Mexican, Puerto Rican, other Hispanic, Latino, Cuban, Salvadoran, Dominican, et cetera, and then finally Spaniard. So why is this origin group highlighted here in this example? Meanwhile, it's not included in white examples. We see German, Irish, English, Italian, Lebanese. And we also don't include any Latin American countries whose majority is white. As we know, Argentina, Paraguay, Chile are majority white countries. Meanwhile, there's...
I'm sorry to interrupt. I just wanted to make sure that other panelists had a chance, so if you could wrap up, thank you.
I'll try, yes. Black Latinos are also excluded from Blackness. Thank you so much for that note. And I just wanted to end on this note on how the own census made a coding mistake and actually added Brazilians as Latinos, noting how that finally led to some data on Latinos that are always erased, which are Brazilians, Haitians, and other non-Spanish speakers. So that's a taste of the origin of where this all comes from.
Thanks, Michelle. And so in the interest of time, all of these questions are related. Is there anyone else who just wanted to add a minute or so, just so that we have an opportunity to address the other issues? Adolfo.
Yeah, that was a wonderful, wonderful history of OMB. And I do think one thing that is important to keep in mind here, and I'm going to be speaking within the context of health research, that oftentimes OMB is regarded as like the standard bearer of how questions about race and ethnicity should be posed in research, specifically in health research. It's like very, very often researchers, especially young scholars, rely on these standardized questions with little reflection on the critical distinction between these two constructs that we're now talking about, ethnicity and race. And this practice oftentimes leads to a really concerning trend about conflating these two. And I think there's a more insidious consequence of this, which is, I think is kind of like the foundation of this talk today, is how it obscures disparities and the racialization of Hispanic, particularly Afro-Latinos, Black Hispanic. I just want to just add that to this important historicity of Michelle.
Wonderful. I'm really hoping that we can go on to the next question. So I'm going to go ahead and pose it. And this is really getting at the issue of data disaggregation and intersectionality as inseparable. So data disaggregation coupled with intersectionality as inquiry and praxis, or breaking data on Latinxs into subcategories such as nationality, ethnicity, Mexican, Puerto Rican, Cuban, Dominican, Salvadorian, Colombian, etc., and race, Black, white, etc., such as by racial subgroups, and gender, as well as educational attainment, nativity, etc., is vital for understanding the distinct preventable inequities within our communities. Why is data disaggregation and intersectionality as inquiry and praxis inseparable for Black Latinos in particular, but for everyone, right? How have intersectionality and data disaggregation been crucial normative tools for your own work in highlighting the experiences of Afro-Latinxs, Black Latinxs? And I see that Dr. Michelle Holder, who hasn't had an opportunity to introduce herself, has joined us, and I'm going to ask if she can unmute and maybe start us off. Are you able? Still. Oh, okay. Anyone else would like to start us off? We tried on the phone, it didn't work because there was an echo, so I apologize for that. But anyone else would like to start us off on this second question for panelists?
Sure, I can start us off. So, I just to pull a thread and put a finer point on, what my other two colleagues have already said. Not disaggregating data and not even giving the option for Afro-Latino identity, it erases us as a people and renders us invisible. And related to that, it completely erases the ways in which we experience racism. And that's racism within and across groups. You can experience racism from other Latinos, and you can experience it from other Black folks, or well, Black, that would be discrimination, but from white folks and others, right? So that data point missing makes all of that invisible, and that's really important. Data disaggregation in general, especially through OMB and the census, allows for distribution of resources in our country, and so that's really important for Afro-Latino people. The research shows that Afro-Latino people historically and in general have fare worse in terms of a variety of different outcomes, whether it's educational, health, socioeconomic. And so when you don't even give us the chance to show up, then that doesn't give us a chance to climb the ladder and get anywhere within society.
Anyone else? Adolfo?
I think I can answer that question by starting off with the Hispanic health paradox. We oftentimes hear about this paradox about how, despite lower socioeconomic status, specifically Hispanic people overrepresented at the lower end of the socioeconomic strata, that we tend to fare much better in indicators of health in terms of mental health, life expectancy, cardiovascular disease. And that paradox does not apply to Black Hispanic. In fact, when we actually dig into the data and disaggregate it by race, we begin to actually see a disparity that mirrors that of non-Hispanic, white, and Black Americans. For example, there was a study that came out a couple of years ago by Michael Paulson using the Centers for Disease Control and Prevention data. And they looked into New York City during the height of COVID-19. And what they found was that Black Hispanic tend to actually have much, much poorer outcomes compared to their white counterparts when it comes to being on the ventilator, being in intensive care units, and more likely to die from COVID-19. But if you were to combine all of those in the aggregate form, you would not see these disparities. One of the more also egregious outcomes that I've seen that really made my jaw drop is when it comes to life expectancy. When we actually see the life expectancy of Black Hispanic, it tends to be much, much shorter compared to their white counterparts. For Black Latinas, it tends to be 2 years shorter compared to white Latinas. And then for Black Hispanic males, it tends to be 5 years shorter compared to their white counterparts. And again, if we were to combine all of this, then we'll say, hey, look, Hispanic are faring much better compared to the non-Hispanic white counterparts. And therefore, we should be looking elsewhere. But no, there's a lot of disparities and inequities within the Hispanic population that is oftentimes obscured.
That is so important for you to highlight. And it shows the failure of intersectional inquiry and praxis that understands that race, ethnicity, cultural origin, et cetera, are not the same. They require different questions if you are to understand a category of experience. And that is why I think this conversation about adopting intersectionality as a normative principle, an ethical principle for making the invisible visible is so transformative. I'm going to move on to another question because we definitely want to have at least 10, 15 minutes for question and answer for Michelle Bueno. Well, hopefully we'll be able to have our other panelists join us. In what ways do you feel like the recent census decision represents a longer story of erasure in the diversity of Latino people and histories in both data and daily life? And I just want to highlight for those of you that want to read more about all the issues that you talked about, Dr. Ricardo Lowe on Google Scholar wrote a paper co-authored with a number of us that looks at Black and some other race and again, erasure. But thank you so much if you wanted to quickly just respond to that.
And thank you for highlighting that paper. And Dr. López, a lot of your work has actually informed my own knowledge. So I want to highlight how everyone participating in this panel, panelists and participants alike, engaging with the intellectual history of Afro-Latinos, and not only that, Afro-Latino erasure. The more we engage with each other about this and learn from each other, I think the more we'll see change start to happen. So to answer your question, and I will go back to my slides. I like to show and tell, as you can see. So I left off on this slide, right? So currently, after, as I highlighted and as you highlighted, Dr. López, the 1977 change, again, over 30 years ago, fast forward to the 2020 change, we still have this, the some other race. And we still are seeing a large chunk of Latino adults identifying as some other race. Is that because Latinos do not belong to a race? We know that that's not the case. It's given these very limited options that are not communicated in terms that Latino community can identify with. They do not use words that our community is more used to hearing in terms of defining race. As Dr. Cuevas pointed out, the American Community Survey is kind of like the hallbearer of surveys everywhere. It's seen as the most accurate survey, the most expansive survey, the one that everyone gets in the mail, and the Census Bureau spends decades working on these 5-year tabulations. It's big. And my apologies, the one that everyone gets in the mail is the decennial census, but the American Community Survey is still seen as one of the most powerful survey instruments. So even great research firms like Pew Research that's actually trying to implement a street race component to their questions, which is going to make a big difference in terms of accuracy of data. Even they rely on the ACS, the American Community Survey, in order to get their sampling numbers and weights. So that means that all Latinos are weighted equally as if all of our experiences are equal. That tends to overrepresent Southwestern states and Latinos of Mexican descent, while underrepresenting Eastern states and Latinos of Caribbean descent, such as Dominicans and Puerto Ricans that tend to live on the East Coast. Not to mention, as I said, fully excluding non-Spanish speakers and including Spaniards. So this has great downstream effects. So politically, much like in public health, we see this kind of non-disaggregated data communicating stories that don't quite align. So I'm going to give the example of New Mexico, right? So 45% of all eligible voters are Latino, the share of any state, which is great. I also want to highlight when looking at single race selection, and to the left, you see the top states by Black only identification and by white only identification. And here I changed the colors, blue representing whether the state was majority Biden voting versus red for Trump voting in 2020. So you see a stark difference. States that have more Afro-Latinos tend to be bluer states. States that have more white identifying Latinos tend to be redder states. I'm not trying to convey any causal claims here, but I do want to point the potential connection that there is in white identification and perhaps Republican identification and Black identification and perhaps non-Republican identification. And going back to the question on disaggregation, why am I focusing on those who identified as white only? Because I don't have a choice, because the American Community Survey, the census' most powerful tool, does not allow for racial disaggregation for those that select Hispanic or Latino. That means the only way to measure race for Latinos is by observing those that only choose one race, which we know research demonstrates that this is not how most Latinos see their race.
Thank you so much. And I'm now going to move on to a question for Adolfo. And as a researcher who looks at the social determinants of health, what do you think are some surprising or perhaps unique ways that Afro-Latinxs experience health inequities? I know you've already mentioned, but if you wanted to add.
Yeah, so I think there are two, and I actually have used CDC's own data to actually show how social determinants really does play a role within the context of racial disparities. And so for one, using 2020 data, what we found was that for Black Hispanic, despite having higher educational attainment compared to their white counterparts, they have higher unemployment rates and lower income. So that really does show you, that there's something, the racialization in our society does contribute to stunted socioeconomic mobility for Black Hispanic. The other one that I have used is more recent data that we just submitted, actually showing that Black Hispanic tend to be much more racially segregated compared to their white counterparts. And when we're thinking about interventions, both at the policy level, at the neighborhood level, or even at the interpersonal level, any particular policy or intervention, I should say, that is really to improve the lived conditions of Hispanic may not necessarily reach Black Hispanic as well. And I think these two forms of evidence from the CDC should be enough for them to actually say that we should begin to disaggregate ethnicity from race. But they're still proceeding with it. At least I should mention at the academic level, what we're also noticing is that darker skinned Black Hispanic tend to report more racial discrimination compared to their white counterparts. This is not at this point surprising to us as panelists, but it's something that I think there needs to be more and more evidence to really be compelling enough to change whatever is actually happening at the policy level for how we actually collect data.
Muchas gracias. And Dr. Holder, any chance that you are on at all? No. Okay, so then we'll move to Dr. Jasmine Haywood. How does anti-blackness manifest and affect Afro-Latinxs in higher ed? How do their experiences differ from non-Black Latinx?
Yeah, thank you, Dr. López. So my research, like I said earlier, is focused within the higher education sector. And based on the research I've done, anti-blackness manifests in a variety of different ways within higher education, whether that be, community college, four-year degree, graduate school. There's a lot of ways it shows up based on the data I've collected. It can show up in curriculum and programming. The one example I'll quickly give is, we've oftentimes Black studies and Latino studies are separate programs. And based on research participants I've spoken to, anti-blackness has shown up in both ways. And so, some of the research participants I spoke to talked about pursuing a degree in Latino studies and not seeing, the history around the African diaspora and how Black folks have contributed within Latino spaces in the curriculum, not seeing that show up. Although less talked about, I'll say that happens in reverse in Black studies as well, where, in that curriculum, there's no approach of intersectionality and you don't see Latino people show up, right? So oftentimes we are treated as if we are raceless. And we need to push back against that narrative because that is not the case, right? We are racialized people. Whether or not you believe you are is something different, but we are racialized people. And so in the same ways that Afro-Latino people should be showing up in Latino studies, they should be showing up in Black studies curriculum as well. And so a lot of my research participants have spoken about that. It can show up in cultural centers and in the co-curriculum on college campuses, where Afro-Latino people, let's say you're Afro-Dominican, and you feel more comfortable maybe going to the Black Cultural Center on campus, but maybe you don't experience a sense of belonging there. Or, because maybe your first language is Spanish, you go to the Latino Cultural Center and they see you walk in and your phenotype is Black. And you don't feel a sense of belonging there, because of the way internalized racism works within the Latino community, right? I know in my own experience, I felt more of a sense of belonging and community within those Black spaces, Black cultural centers, Black faculty on campus, because of the ways that I experienced racism from other Latinos. And so, the experiences differ. Some of my research participants experienced exclusion in both places, or some of them just experienced exclusion in Latino spaces. And so, a lot of the factors that go into why that differs is based on things like geography and ethnicity. An Afro-Latino might have a different experience in California than they do in New York City, for example. And so all of those things go into even institutional type. There's starting to be a subsection of literature that focuses on the issues of Latinos at HBCUs, right? And initially, what that early research was telling us was that they were not feeling a sense of belonging, but there was no data collected on the extent to which they identified racially and the extent to which they may have been Afro-Latino. So, when you look at Afro-Latinos specifically at HBCUs, there is a sense of community and belonging there, and that's really important to note and highlight. And there are some younger scholars coming up that are starting to do that work. So it manifests in a variety of different ways in higher education. I'm going to drop a link to one of my publications in the chat if folks are interested. But higher education is just a microcosm of the larger world. And so a lot of what I have seen in terms of the findings in my research are really just manifestations of what we see more broadly in society. And I'll say, really, this is an instance where the devil really is in the details, and where it is important to have disaggregated data on Latinos, and also to highlight those experiences.
That is so important. It makes me think about how important it would be to include a street race question. If you were out in public, what race do you think others who don't know you would assume you are based on what you look like, to capture that lived experience with anti-blackness on campus, which is often under the radar when we pretend that all Latinos are racialized the same way. So thank you for your transformational work. Before we open up for questions in a few minutes, I'm just gonna do a little rapid fire and have each of you respond. What are some of the actionable steps and strategies that we can take to ensure that Afro-Latino voices and experiences are recognized and addressed in federal data collection and beyond? And with this, I just want to clarify for everyone in the webinar, the OMB guidelines are for federal agencies. They do not apply to anybody else. So we can still maintain two separate questions that clarify that race is a visual status, ethnicity is cultural heritage, and even federal agencies can add an additional question like the one I just suggested on, if you were out in public, what race do you think others would assume you are based on what you look like, which is not just skin color. It has to do with facial features, hair texture, everything, right? It's not simply skin color, a street race question. But I'd love for each of you to take maybe 30 seconds so that we can enjoy the wonderful questions from our audience. Whoever would like to start.
I'll kick it off. So I work in quantitative data and survey development, and I saw one question in the chat actually on how each of us are working to kind of ameliorate this gap in the data. So I design my own surveys, and I design also representative surveys that aren't necessarily weighted by these OMB standards. And I included a question using a skin color scale that I developed that is not just a one-way scale from dark to light, but also incorporates different tonalities and skin tone. So folks can, put their hand up on their phone screen, or if it's printed, and look at the color in the back of their hand and select a color. I ask questions about hair texture, in addition to questions about ancestry, in addition to questions that include terms like trigueño, mulato, mestizo, moreno, sambo, garifuna, etc., terms that are more common in the communities that we come from, and hoping that this will lead to some clarity in the actual street race and also racial identity that folks feel when responding to surveys.
Gracias.
I'll be very quick here. I think there is oftentimes this idea that whatever decisions being made at the federal level has to kind of spill over into other domains. And I think what's important here is that rather than taking a top-down approach, we could also take a kind of like a bottom-up approach here by maintaining our principles and how we should be collecting data. So like the future Dr. Vasquez here, she mentioned some ways that we could actually capture the multidimensionality of race. And I think that's very important. And by maintaining this moving forward, hopefully it has a kind of like a spillover effect upwards. And I think that's what hopefully we could actually take away from a lot of the research that we're doing in this area.
Wonderful, thank you.
Yeah, I'll be quick and just wrap us up by building off of Dr. López and saying that the federal government doesn't regulate all forms of data collection, and so work from where you are and impact the things that you can impact in terms of the way data, specifically Latino data are collected. And I'd say both qualitative and quantitative are important. One of the things that I say in the work that I do in philanthropy is that it's important that every number has a story and every story has a number. And so, those mixed methods approaches are really critical to giving voice to all people, especially Afro-Latino people. And, if you work at a think tank, a research institute, there are ways to, especially I would encourage the use of social media to get voices out there and stories out there. I am not an expert on that. I depend on younger people for those things, but I think the more we use advocacy and storytelling to really highlight experiences will be important. And the last thing I'll say is, I don't think for a second that this decision was on accident or was a mistake. They knew exactly what they were doing. This is an effort to diminish our power and our visibility and our voices as a people because we were gaining traction. And so I would just stay encouraged and stay in the fight.
Gracias. So we have a couple of questions and I'll start us off, and anyone who would like to respond. Can you speak more about why separate questions are required for race and ethnicity versus a check-all that apply? Also, if race and ethnicity are measured separately, how should quote unquote race be measured to make brownness visible? For example, not categorizing non-Black Latina as white or some other race. Yes, Michelle.
Yes, this is a great question. So in survey research, there's something known as satisficing. Satisficing means, how when you get a survey, like how likely are you to return to our store? And it says not at all likely, somewhat unlikely, neutral, somewhat likely, very likely. And we all just click neutral because we're like, just let me go. A similar thing happens when you ask Latinos about their race because of this historical delegitimization of Latinos having distinct races, and Latino being a race, the way the census has constructed it, most Latinos don't want to think about their race, especially white Latinos, because it makes them uncomfortable. Black Latinos might not want to think about their race because it makes them uncomfortable. It reminds them of the experiences that Dr. Haywood pointed out, experiences of exclusion. Maybe Black Latinos, Afro-Latinos, or even Mestizo Latinos, brown Latinos would want to not think about race, suppress that identity to protect themselves, to feel accepted by Latinos writ large. So having a check-all that apply enables that neutral kind of like, let me get through this survey. Yeah, Latino, move on, and not have to think about race in addition to Latino identity. And in order to capture brownness, absolutely correct, there needs to be an additional racial category to include this kind of brownness, which is why I suggest adding mestizo as a racial category and defining what it means, giving examples, adding trigueño perhaps as a separate category, defining what it means, giving examples.
Thank you so much. And in the chat for everyone, I just dropped a study that I co-authored with the Urban Institute that used brown, for probably the only empirical study that I know of national that said brown, not Black. To be very clear, like my husband is Chicano, brown. He's subjected to a different type of racial discrimination than anti-Blackness. Therefore, there is a space for making that visible through a street race question. But anyone else who would like to respond?
I just add really quickly that Michelle mentioned oftentimes there's sometimes a denial in terms of not wanting to mention race, and I know that's true with the older people in my family because of the way internalized racism works. I will say since I've completed my dissertation now about a decade or so ago, there is a growing amount of Afro-Latinos that are very proud to identify in that way, right? Like you start to learn your history because oftentimes you're not learning it in school, but you learn your history, about people like Arturo Schomburg and other prominent Afro-Latinos. And I have seen through social media platforms and others, an increase in just a very heightened sense of pride to identify in that way. And I think that's also worth noting and taking advantage, using that generation to help with the awareness building of maybe some of the elders in our community, right? I know I have these conversations where it's like, yes, I know you're from Puerto Rico, I know you're from Dominican Republic, but let's talk about your phenotype and your features and what has your experience been in the US and why it's important to acknowledge your Blackness just as much, if not more, as your Latinidad, right? Because I'm a Black woman first. because that is how I am racialized, and because that is the composition of my blood, right? And so it's important to really to acknowledge that growing pride and how it's impacted us.
Anything to add, Dr. Cuevas?
I mean, this is all rich. I think not directly to answer your question, this is a bit indirect, but I think it's an important question or important thing I have to add here, whereby I remember attending a talk from Ellis Monk, and a questioner asked him, given that you're working in the area of colorism and health, do you think by highlighting colorism, you'll be stunting the solidarity within the Black community in terms of gaining political power and political will? And a very similar question was asked to me before, and I wish I would have answered the same way that he did, whereby someone said, well, if you're highlighting race within the Hispanic population, will you be stunting solidarity and the political will within the Hispanic population? And, I can now respond by saying that we could, chew and walk at the same time, that we could both highlight racialization within the Hispanic population, but then also still gain a political will to address issues that affects all Hispanics. And I think this is really important in moving forward, that there will be people, especially people who have power within the Hispanic population, that will be kind of pushing back and say, hey, wait a minute, by talking about race, you will be stunting the mobility that we have been gaining as Hispanic. And I think this is a way to kind of push back on those counter arguments by simply saying that we could do both at the same time. We could talk about the racialization, the mistreatment that Black Hispanic receive from police officers, the discrimination that they experience within the healthcare system and within the education system, and at the same time deal with issues that affect all Hispanic in terms of immigration issues, documentation status issues. All of those things are issues that we could actually grapple with at the same time.
So we only have a few more minutes left and one more question, but before we get to that, I did want to just mention a response to the check all that apply question, because it's incredibly important. Census data are not a survey. It is a total population count. And I want everyone to register that in their mind. That is used for voting rights, apportionment, for program delivery, for recognizing what resources are needed for emergencies, etc. And so when you check 2 or more, just so that people are aware, we don't know what your state is going to do with that data. And right now, Louisiana has a case right now where they're deciding they're counting as Black only those who marked only Black and white, but no one else. So be aware that once it is true, you can mark all the boxes that you want. But when it comes to apportionment, when it comes to voting rights, we don't know what's going to happen with 2 or more, and it's not a civilly protected category. Tania Hernandez has written about this in her amazing trailblazing work on multiracials in the civil rights era and racial innocence. But I just want us to be very cognizant. And actually what's happening in higher ed, and I'm sure that Dr. Haywood is aware of this, that a lot of people are now saying, I'm going to count you 3 times because you marked 3 boxes. So now this is a percentage of Black students and Hispanic students and Asian students and Native American because you checked 4 boxes, which actually is statistical gaslighting, right? So here we have a situation where people are not being told that once you mark 2 or more, you really do not know what's going to happen with that data, especially for something like voting rights apportionment. But anyway, the last question that was posed is, can you clarify the definition of street race and where it came from? So one thing that I put in the chat were several of the peer-reviewed articles in sociology of race, ethnicity, and critical public health, along with the Urban Institute study that I co-authored. I, in 2014, wrote a blog that was published in the Robert Wood Johnson Foundation Health, Culture of Health blog, where I talked about the need for street race. It's not a new idea. People have been talking about, Kamara Jones has been talking about perceived race. It's simply another way of making this much more accessible to larger audiences beyond academia instead of calling it socially assigned, ascribed, folk race, etc. It's simply a way of recognizing that race is multidimensional. It's not simply about how you see yourself. It also has to do with a social status that happens when you are accessing resources, etc. So I don't know if anyone wants to add anything to that because we're at like the 2-minute mark before the end of the webinar, and I want to make sure that Cecilia has a chance to wrap us up. All right, so I am so grateful to each of you for your voice, your expertise, your passion, your corazón, your solidarity with including and centering the Black Latino experience as a way of creating unity in our families. I think a lot of people in some Latinx communities believe that talking about race is divisive, but not talking about it is actually harmful. Because we do want to create a familia where everyone's welcome and that we don't pretend that Black Latinidad exists outside of Latinidad. So with that, unless anybody wanted to add anything else, I will turn it over to Cecilia to wrap us up, and massive gratitude to our audience for being here, your solidarity, your leadership. Mil gracias, familia.
Truly, thank you. Thank you so much again to Dr. López and our wonderful panelists for taking the time and thought to make space for this conversation, for their flexibility through unfortunate technical difficulties, and their broader work to uplift the Afro-Latina and larger Latino communities in their various sectors. Here at LPPI, we are committed to continuing these and other dialogues about issues impacting Black Latinos, and are excited to announce some recent publications that further explore topics related to Afro-Latina policy. Last month, we published Latino is Not a Race, Understanding Lived Experiences Through Street Race, authored by myself, Julia Silver, Misael Galdamez, and Dr. Nancy López, which takes a deeper look at the inclusion of a street race question, a concept discussed today, as a potential improvement to the census and other federal surveys, and the need for accurate census data for Afro-Latinas. Just last week, we published The Labor Market Experiences of Working Age Afro-Latinas by Misael Galdamez, Julia Silver, Dr. Rodrigo Dominguez Villegas, and Dr. Nancy López, which analyzes fascinating data on the experiences of Afro-Latinas in the workforce, inspired by Dr. Holder's own book with Dr. Alan Aja, Afro-Latinos in the U.S. Economy. I would invite people to read it, especially to get more insights into some of what Dr. Holder was going to speak to us about today. Additionally, in 2023, we launched the Latino Data Hub, a groundbreaking tool that allows for analysis of data on 10 different issue areas related to Latino life, and that incorporates a variety of disaggregation tools that can be used by researchers and policymakers to ensure Latinos remain a part of future conversations. If you would like to stay informed about these publications and other upcoming work here at LPPI, feel free to scan the QR code on the screen now to sign up for our newsletter or visit our website for more information about how to get involved. We hope to continue to be a space for these vital conversations about issues impacting our communities, and welcome your support and partnership in these efforts. Thank you so much again for coming out and participating in today's discussion. And with that, this concludes our webinar for today. Have a great rest of your week, and thank you again for everyone.